and this is our community dialogue on health and wholeness. So we have a great group of health professionals in the community joining us by Zoom this evening. And in a moment, I'll ask them to introduce themselves. And the topic for this evening is restoring your physical health and taking a look at finding balance between your external and your internal resources, given some of the changes in circumstances. So whether you're suffering from chronic pain, you have chronic health conditions, or you're simply looking for new ways to explore how to restore your health physically while you're either at home and or some combination of in community, this will be a great format, and I'd encourage all of you to share this evening. Kathy is helping field our Facebook Live, so I'd ask her to let us know if we have any questions on Facebook Live. And from here, I would like to go around and ask folks to introduce themselves. So I'll select a person, and then after that person introduces themselves, could you pick another person? We have names on all of our screens here for everybody joining us by Zoom. So if you could introduce yourself and just let us know a little bit about your role in the community for health and wellness, that would be great. So John Wrights, if you could introduce yourself.
Sure, I'm John Wright. I'm a counselor with Shelter Cove Counseling. I also do oversight for global workers in both Europe and the Middle East. And before I did this, for 33 years, I was a pastor. So I mix all those things together. Mark.
Hi, I'm Mark Potts. I'm with Living Well. I'm an integrator with Living Well, and before that, I had a corporate background and did a lot of behavior change management work for Hershey.
Thanks, Mark.
Sorry, Karen.
Good evening. My name is Karen Gish, and I am also part of the care team at Living Well Institute, as well as on the board. One of my passions is the area of spirit, and I have 3 young adult children that just bring me great joy. How about you, John Spottyberger?
Hey, hello, everybody. Right now, I'm winding up a 25-year-old sentence with Dauphin County Drug and Alcohol. June 5th is my last day working with. I have loved working with the folks, especially those who are homeless and incarcerated, and I'll probably find a way to continue to do that for a while afterwards. And I know it's the right choice, but it's still a little bit difficult for me. So I'm staying close to the people that I love and that love me. So thank you. Kathy?
I am Kathy. I help at Living Well. I'm a nurse there and work with some of our clients. Yeah. Hey, Jen, welcome.
Hi, I'm just guesting tonight, so thank you for having me. So I'm Jen Krasniewski. I'm a primary care doctor at Penn State Health, and I spend most of my time doing public health research. So thank you for having me tonight. Penny?
Thanks, Jen. I'm Penny. I'm a chiropractor. My husband and I have a practice, and we also are the originating family of Living Well Institute. I love the concept and the topics of health and wellness, and I'm so excited to see you guys all on Zoom tonight, and I'm so excited to see Vern. Thanks for joining us, Vern.
Hi, Penny. How are you?
I'm good.
So I saw your blurb on Facebook, and I decided to just join in and see what you're up to. I have no medical profession here. I'm just a bystander looking for a little help with my chronic back pain.
Well, thanks, Vern.
I can't see anybody else here. Hold on. That's all there is.
I think that's everyone on Zoom. Kathy, did we have anybody on Facebook Live that wanted to introduce themselves as part of the conversation? Okay. Well, thank you again. I'm grateful for the expertise and the folks that have joined us tonight for this program. And I would let you know that we've done these programs probably for the last 3 weeks. We're doing them twice a week. We're trying Monday evenings at 7 p.m. and then Thursdays at 7 a.m. And the attempt is to try and provide enough of a spectrum of time that folks can contribute and at least participate by Facebook Live to gain some information that may be a little bit different than what they're receiving on other channels out there. And part of what makes the Living Well approach different is we take a holistic approach that considers the fact that we all have a mind, a body, and a spirit, and they all have significant impacts on our health and well-being. So tonight's topic, as we're looking at physical health and the different use of external and internal resources, I would pose the question for anyone on the Zoom meeting tonight to be able to share your perspective on physical health and what you're seeing in our community. I think there's been a lot of information on COVID-19, on prevention, on symptoms, and on the impact both locally, regionally, nationally, and globally. But we have a real diverse team here, and both from your personal experience in the community as well as your own unique perspective on physical health and external and internal resources, I'd invite you to share.
It's Mark. Well, in my neighborhood, the world has rediscovered walking. And all day, every day, there's a flow of people walking with or without their dog, and occasional bike riders. And that's a really good thing. I mean, we've known for many years how good walking is for general health, but there's been some studies released recently that start to give us some insight into why it's so helpful and helps. I won't get into the weeds here, but it helps with the production of lots of chemicals in your body that are good for you. And we'll leave it there.
Thanks, Mark. Wow, we've got a quiet group tonight. You know, Vern, I would say I really appreciate your transparency in saying that you're part of the community and interested in hearing on different ideas on how to address your chronic pain. I think that's one of the most common complaints that people come to Living Well Institute with is chronic health conditions and really pain. And I think we've seen that pain can manifest itself physically, but really in the world that we're living in, pain tends to be the common denominator that knits all of our lives together. And at one point or another in the human experience, there's no doubt that we've all experienced pain, and how we address that pain, especially in these changing times where many people in our community are reliant on external resources that are systemic, it looks a lot different. And so we've been getting calls and interest from folks just like you, Vern, that are saying, how can I be creative in addressing my chronic pain while I'm at home and while maybe my access to resources looks different? So I don't know, Jennifer, if you have anything to contribute to that, or Kathy, from your perspective, and Penny as well.
Yeah, certainly chronic pain is one of the #1 reasons patients see us as well in primary care. And so I really appreciate the multimodality interventions that's being discussed here. I think that's really important. And I agree that the brain-body connection is really strong. And in times like this, pain may worsen for lots of reasons. So thinking about how to deal with that when the typical social support networks may not be in place too is really important. So I appreciate that you all are doing these Zoom calls. They're virtual, but they do allow us to see faces and make connections with people, although in a different way.
Thank you, Jennifer. Penny and Kathy, did you have anything to add?
Kath, I'll go ahead because I'm sure you have a whole lot to say, but I'll just interrupt here first. I think about the whole concept of pain and the utilization of internal and external resources. Steph, I was thinking, you know, I think a lot of times we think about pain and we look towards some external resource or clinical solution that allows us to gain some relief from pain. But it's amazing how many times, even as a care provider, that sometimes the concept of physical pain begins to either create additional mental or social spiritual responses, or sometimes spiritual stress can actually manifest or exacerbate our pain. So I think one of the things I'd want to just kind of gain some understanding with the diverse group of people that we have is the fact that pain, while many of us identify it as a physical manifestation of a discomfort, the cause of it as well as the cure for it can oftentimes be multifaceted. And so I think I just know it in my own life, both personally and professionally, that there's people that in my own life, I can have physical pain that can be just in response to a true physical pathology or a problem. Like if I eat something that doesn't make my body feel good, I eat something bad and it makes my body feel bad. But sometimes when I'm trying to do something good, I can get a bad response. And I think one of the things that we try to do in Living Well is to begin to allow people to look at pain and begin to understand not only the psychological components of pain, but also how the physical pain can begin to wear us down and create emotional and spiritual and really relational dysfunctions. And I think in this season now where we are to some degree are becoming very aware of an invisible pathogen or an invisible problem that has us all responding out of, most of the time, out of a sense of increased stress. And so what normally will happen with increased stress is it creates a preoccupation in our mind with what is it? How do I make it go away? We worry about how it will impact us, but it doesn't take long for that mental disorientation of stress to begin to exacerbate problems that we have. So, you know, I guess I was thinking when you started to talk about this stuff, you know, I think many people come into our office with physical pain. And I think the most valuable thing that we can do to serve people is to be able to give them, whether it's physical solutions, both external, like exercise or med management, or some physical approach to address the pain, but also to be able to teach people how to manage their pain and not have the pain manage them. And so I think, yeah, all of us can look back at our life probably and realize that there's times we had emotional pain that eventually compromised our physical well-being. And there's probably times when we had physical pain that began to impact our emotional, whether that was our ability to concentrate or even our ability to have emotional stability. So the interconnection between the physical and the mental and the spiritual, I believe as a care provider, the best thing that I can do to better serve my clients and patients is to give them a platform and an opportunity to recognize that we live in a season and in a culture and in a country where we can have accessibility to physical, mental health, and social spiritual resources to help us really minimize the pain that we live in.
So I'm just going to follow up that with one of our viewers said, self-care is bigger than I ever thought. And he said he was suffering from immense pain all the time. And one of the things he does is he's really changed his perspective and he tries to be healthy or happy. And it really helps him. So thanks, Scott. I appreciate that. He's been just sending them lots of updates. So yeah, I think that especially given this time now, with everyone self-isolating or isolating and just being isolated from friends and having limited connections, I think it is a time when people do tend to have more issues with pain, and it becomes easier to self-internalize them and not be able to see the end of it. So yeah, finding ways to renew our bodies and like just figure out ways to get outside of ourselves is really an important thing for all of us.
Thank you, Kathy. You know, Penny had asked me to share a little bit about my personal story and how I came to Living Well 3 years ago, and it really was at its root connected to physical pain and to family issues with addiction. So John, I'd ask you to contribute to this as well, because when I think about our community and people who are suffering from physical pain, many people find themselves in addiction because they're taking things to address that physical pain, or the emotional pain is at the root of that addiction. And so I came to Living Well 3.5 years ago with chronic neck pain that at 36 years old really didn't have a lot of logic behind it. I had been in a car accident, I went through the diagnostics, and I had an MRI that showed that I had some bulging discs, and I knew I had some choices. And so I had gone actually to Penny's husband, Dr. Dan, for chiropractic and tried to deal with it physically. That didn't help. I tried physical therapy. And meanwhile, I knew at some level that my mental health was both contributing to the pain and suffering because of the pain. And so I'd gone through years of psychotherapy, of just trying to deal with the anxiety that was racing through my mind and that was having to some level an impact on my life. But I was functional. I had a job. I went through grad school. I had a great family. I had great friend resources, owned a home. So from the outside looking in, I was fairly typical, fairly stable, and looked like pretty much everything was okay. And inside, I realized I had gotten to a place that the pain that was in my neck, the pain I was experiencing physically, the pain I experienced in my mind with the constant racing of my mind, and then the impact that that had on my relationships, it may not have been a matter of life or death, as the doctor had looked at the MRI and said, well, your only option is neck surgery. And when I looked at it, I knew that that life or death was something inside of me that felt like the quality of life wasn't something that I could look down the road of my life journey and realize that was something that I wanted. And so I knew I needed to do something different. And I grew up in a real traditional background of knowing that, you know, you go to the doctor when you have a problem, you get a counselor, you have your community. So I had my resources from a mind, body, spirit perspective pretty separate. And I think up until then, I probably would have said that I had integrated them, and yet I realized I wasn't getting the results that I wanted. And I also knew at some level that all of the pain of what I'd experienced in my family, and I'll preface this by saying I have an incredible family, and like all families, there's some level of issues and problems and dysfunction. And my dad suffered from addiction, and I knew that at the point at which my pain was too bad that I needed to go to the doctor and they prescribed me a muscle relaxer, I said, pump the brakes. I just knew that I didn't want to go down that road of having a pharmacological resolution to my pain, which is when I picked up the phone and called Penny at Living Well Institute. And I realized pretty quickly through the experience that I was given at Living Well, which was an integrative lifestyle education program, I was able to see within a couple weeks the connection between what was going on in my head and my heart was manifesting itself as physical pain in my neck. And there's no doubt that from a diagnostic perspective, you could also look and say, well, I had bulging discs, I'd been in a car accident, and I knew I had a choice to make. And I thought, well, I have nothing to lose. The doctors aren't telling me that I have to have neck surgery or my head's gonna fall off. It wasn't as though I couldn't function in daily life, but I also knew I was barely hanging on at a job that I was passionate about before. The passion had kind of gone out the door, and I was just struggling day to day, waking up with chronic pain. And what I experienced in those few weeks of a group of people who gave me the space to really discover what was going on the inside, it just was a different perspective to look at some of the emotional and trauma that contributed to that pain, and then have a space to recognize that I had a choice in how I dealt with it. And so it was a completely different perspective for me to look at the difference between external resources to address whatever that pain was, to really dig deep and say, wow, do I have some internal resources I haven't thought about that could contribute to a different quality of life? And I think I knew the model that I had growing up at a home was that when there was pain, whether physical or emotional, there wasn't necessarily always the most healthy model of how to address that. And so I think, you know, I'd be curious, John, for you to share as well for some of the folks in our community who either were struggling with addiction and now are isolated socially, some of their resources are taken away. You know, I think the pain that we're experiencing in our community now through this isolation it may manifest for some people as physical pain, but for others, they're really struggling with the demons of addiction. And I think we'll be better suited as a community to look at these things proactively now and to help equip our community so that as the world starts to open up a little bit more and we have a handle on what life is going to look like once we address some of the COVID-19 issues. Yeah, I think this is a great group to discuss that.
Yeah, I think, you know, you said a lot there, and my head goes all over the place with different things. But one of the good things about this right now, as far as external resources go for people, there's a lot of 12-step meetings online. There's a thing called In the Rooms. I just did an AA meeting on that. Yesterday, yesterday there was that was Saturday, a summit type thing where they had 3 different topics. It was like going to some type of conference for recovering people. Both Dharma Recovery and Refuge Recovery have meetings online. So, you know, that helps. I think people who have been around for a little while and that are working programs. I think the dangerous thing is for newcomers, people just beginning sobriety, because it's difficult when you first get clean and sober to, you know, understand what you're suffering from. And when everything comes up, whether it's a physical pain or an emotional pain, of always looking for something to deal with it. And it doesn't really matter how that, give you a little thing on that. A couple of months ago, I went to the orthopedic guy, and my knee, I have that osteoarthritis stuff, so it hurts now. And it doesn't hurt all the time, but sometimes it hurts. The other night, I woke up and my knee was hurting. I immediately thought of how much oxycodone would help me, okay? And then I know I can get it because I can call a doctor and get it, all right? And say, you know, my knee's really bad. They've given it to me for it, but I get a refill of it. And I would get it. That's how an addict thinks. The alternative then in doing that is to call somebody else or get to a meeting online or things like that. But the whole thing with medication, when we start out, and a lot of the folks that I've seen, I would say 70 to 80% of them started in their addiction through the use of pain medication, okay? They go and they go and they go, and then at some point they're told they can't have it anymore. And so then, and these are folks that you would never imagine being on the street, especially in Allison Hill and those areas, you know, trying to cut some dope, just so they don't feel, you know, the pain. The other side of that too is after we do medication for a long time, we don't know whether we have pain or not. You know, we've thought about that. We just want to prevent pain, and we imagine that it would be there. I mean, there's so much goes on, and I think I'm going through like really difficult time because you know, up until about a year ago, I worked really hard on my health, and I really did well. Ate greens, nothing else. Okay, lost 40 pounds. Was really active. My mood was better. I can't narrow down what triggered, you know, leaving from it, except probably my job and the stress that's built and built and built, where I found myself. I'm so unhealthy right now. I really am. But my goal in this time off is to be able to do things because I can go out and walk. I was up at Boyd yesterday. I took a friend up there and walked, and there was more people there yesterday than I ever saw. And it was sort of good and bad, you know, because I thought, well, it's our place. We don't need all these folks up here, you know. But it was still quiet and peaceful. In trying to, for me, it's just trying to get a handle on, okay, what's doing all this, okay, and then looking how I can get some support for it. I'm not going to say help so much, but support. And I think that's what we all need. And any resource that we come in contact with needs to be supportive rather than, you know, telling us what we need to do. I think most of us know what we need to do. It's just the support doing it. And I've been blessed in my whole recovery. I've been clean for a bit over 37 years. So it isn't that I'm not something really special for doing it. Because there's been plenty of times I could have done another thing and I didn't do it. But I didn't do it because there were other people in my life that depended on me, okay? And that looked at me in a more positive way than I look at me even today. So I don't know if that helped out or not, but I mean, there's just so much to this. And getting well is a whole person thing, right? You know, whole
Yeah.
person. Yeah.
Thank you, John. I appreciate it. I'm going to ask the other John if he'd be willing to share. You know, I think about the work that you do both locally, regionally, and across the world to help people address their emotional pain. I recognize we've talked about the connection here to physical health, but I think about your work from a family system perspective, and wherever people are at this point, working or living from home, and how they're addressing this looks a whole lot different than it probably did a month ago. In some ways for better and some for worse. And I think if you could share some of your experience in that, we'd be grateful.
Yeah, one of the things that we focus on at Living Well is body, mind, and spirit. One of the things through the years that has really struck me is the clearest and most truthful voice is our body. It's very easy to play mind games. So the mind, you can sort of weave some things around and be able to navigate things that normally you wouldn't want to navigate. And it's easy to construct spirit in such a way as to make the things that I do be the right things to do. But the interesting thing is the body is made in such a way that it speaks volumes. And to be able to realize that those are good messages that are coming, not bad ones. And usually they're directing us to the mind and the spirit. And to begin, that's why looking at things holistically is so important. But to be able to sort of know that I can't fake body like I can fake mind and spirit. And so it almost becomes the revealer to us. And so I through the years, have become much more aware of how my body is speaking to me and try to help people with that as well. It's also, if you go in the other direction, mind and spirit can be very helpful to the body. I'll give you an illustration. I have not dealt much with health issues throughout my life. I have had a heart attack, but I came off of that quickly. Since January, I've had 3 surgeries on my eye. So my eye has been quarantined and will be for another 2 or 3 months. The biggest issue of that is really not my eye, but it is my mind and my spirit. And so I have decisions to make whether I will allow that to be the center of things or go to the center and see it more as a circumference issue. And what it's done for me is made me very appreciative rather than frustrated, but also has allowed me to go down the road. What would happen if I have problems in both of my eyes and I went blind? What would my attitude be? And so to me, it doesn't turn me to worry as much as it is appreciative of what I have, but also continuing, and this is the aging process. So I'm closer and closer and closer to the next stage of life, but to be able to recognize that the things we handle earlier in life are really part of helping us get ready. It doesn't mean that we're going to lose our physical well-being or mental or spiritual, but you better have it more intact as you age or you're in trouble. So that's a few thoughts.
Thank you, John. I appreciate that. Jennifer, would you be willing to contribute some from your perspective? You work for probably one of our largest health systems locally. And, you know, I think there's been a lot in the news about physical health, and certainly Penn State Health helps us with that. And I would imagine it's been a tremendous shift from a lot of the patients now not having the same level of access to the one-on-one care with physicians. And it really is, it's a paradigm shift in terms of people needing to actively participate in their care versus a rather passive role that many people in our community have been accustomed to. And just curious from your perspective, what Penn State Health is doing for the community, and also what the community can do for itself as Penn State Health tries to deal with some of the trauma that's experiencing in the community.
Yeah, those are really fantastic questions. The health system has done a really outstanding job preparing and being ready for the pandemic before it kind of reached our community. We've been fortunate. You know, we had a lot of warning shots in hot spots around us. It gave us time to prepare and to learn what we had to do. But with all of that fantastic work, I do worry. Our hospital census is down. Where are the other patients? So I think that there are people who are not recognizing that they need to be seen for physical health. There's no statistical reason right now, you know, and as a public health researcher, for us to have less heart attacks or less strokes in the community. And so it makes us all worry if people are getting sick right now, that they're not seeking the care that they might normally seek. I know that our primary care practice has been as busy as ever, if not busier, because we also help field the calls for people who think they might have COVID-19. From that standpoint, though, we've really changed our practice. So it's not in person as much. We still see some folks within our clinic walls, but a lot of telemedicine. And that brings new challenges to all of us. New understanding. It's a different way of being able to check in with people and relying on different indicators for health than we normally do. There's no one checking one's blood pressure or height and weight when they come in the door. We don't get a chance to use our stethoscopes very much right now. So I think from that respect, I would like to share with anyone listening who's concerned to please call. You know, we are here if people have symptoms they're worried about. We are doing a fantastic job as a system keeping people safe. So we have anybody who has symptoms of COVID-19 does not come into our primary care clinic. We have a special clinic set up just to investigate so people can get care, but they're separate, which helps mitigate the risk of spreading to others. Within the hospital, we have special units which are taking care of all of the patients who have COVID-19, of which we have, you know, a couple dozen right now in the hospital. So from those standpoints, we're doing everything we can to keep everyone safe. If you come visit us, you'll see we all wear masks now, which is also really different. And those are the same kind of masks that folks are urged to wear if they're out in the community. So those are not, the mask I wear in clinic doesn't protect me if somebody has COVID-19, but it does protect my patients if I happen to have and be an asymptomatic carrier, someone without symptoms but carries the disease. So we do have the right kinds of special masks if people are exposed to patients who do have COVID-19. So we've been really fortunate. We have a wonderful you know, supply chain that's in place to help provide all those things, you know, that you hear about on the news where they're not as lucky in places. So I would say if you have this time at home, it is a wonderful time to reconnect. Someone made the comment early on that they see more people out walking than ever before. It's a great time to spend more time. I know that my husband and I are homeschooling / working from home most of the time with our daughters who are 8 and 12. They're largely self-parenting, but it's a good chance for them to learn skills too. We, you know, have the luxury that we usually have somebody who can help us keep our house clean, who of course we're not having right now. So our girls are learning how to clean the bathroom. So good life skills there. So lots to keep us busy, and new habits of things like a family walk in the evening, which is not something we usually would do when school kept us busy, and after school activities and all of that is largely slowed down. But along with those physical health, I think the connections to others, the best that people can do, are really, really important. So I know for our girls, they have Zoom dance lessons, which is a big deal for them. So making the best of the situation. And I can't help but think in 10 years from now, when they're both in college or beyond, that they'll look back at this as, as an experience. Not one that anyone would wish for, but the silver linings in all of this, I think lessons that are learned. I know clinically, we have a daily call that our group meet. We used to meet once a month. We now meet practically daily to talk about concerns and challenges, and we're looking at what do we take from this? What are the best practices from this time that we can move forward? We were able to see patients at their home, and they don't have to, pack up their children or take off of work to come see us. So how can we move some of that forward? So I think we'll see changes in how medical care is delivered after this. And so I would ask that people have an open mind of what that looks like. And if we do it with the patient at the center of those decisions, I think there'll be great changes for us to make.
Good. Thank you.
Jennifer, I'd ask one more question, and I think you led right into it in terms of talking about what some of the changes we'll likely see from the health center perspective. I'd ask as a public health researcher, what changes if you had a crystal ball or a magic wand and would say, this is what I'd love for our community and really people in general to learn from this? What would you say?
Yeah. So the public health researcher in me, because you mentioned that piece and I wear that hat a lot, I would say to challenge anybody here or who's listening to be a citizen scientist. So what does that mean? The images I saw in front of the Capitol building, really, really are difficult to see today, the protesting that's happening. To think that we did too much to prevent this from causing deaths because we don't have a lot of deaths is like saying, look at how few automobile deaths we have now from automobile crashes after we initiated the requirement to wear safety belts. So if you think of it that way, if a public health intervention works really great, nobody notices it. So we don't see typically outbreaks of polio and measles because we have a vaccine, and we've cut the number of deaths from car crashes because we require seatbelts to be worn. So everything that's been put into place has been, I think, very thoughtfully done. It's had unfortunate consequences, and I don't want to make light of any of that, but we've saved many, many lives that would have been lost if we hadn't done this. So at some point, somebody weighed those risks of what do we need to do as a society, and I'm grateful that they place lives over dollars. And if we can figure out the best ways to reopen and do it in the right way, we won't see a second surge, which is, of course, what everyone's worried about. But the decisions about resources and scarcity of those with ventilators are very real, not here in central PA, thankfully, but in other parts of the country where they have to make some really, really difficult decisions that we don't usually have to make in this country. So I hope from that standpoint that we realize what we have and are grateful for that. There are so many countries around this world where people don't have that privilege to not worry about ventilator beds or worry about somebody there to take care of them. So hopefully this will make us more grateful for the things that we do have. I hope it'll push us to embrace technology more. Medicine, healthcare is, perhaps the slowest uptake of technology there is. We've had to learn some of this really, really fast. It's not great. The platforms we have aren't super patient-centered. They haven't been developed with that in mind. So hopefully this will push the technology further, and we'll use it in ways that we can provide better care, not just a substitute because we can't see you in person.
Thanks, Jennifer. That's great. I'd ask Penny and Kathy to jump in here and add on to what Jennifer was doing. One of the things that she highlighted was that it's likely, at least based on her practice, that she's seen a lot of people who actually need care are not actually proactively seeking care. And as I think about it, Living Well Institute, we're considered as an essential business in the work that we're doing and helping do a lot of crisis care and stress management. And I think we're grateful for the opportunity to serve our community and recognize that it's because our community is in crisis. And so I'd ask Penny and Kathy to share a little bit about the clients that we take care of and some of the things we're seeing, because I think it may illustrate for the people that are watching on Facebook and even considering the people that we know in our community that may be in trouble and that may be either reluctant to ask for help or thinking that there's some barriers to them receiving help.
So Jen, yeah, Steph, when you talk about what we get to do in Living Well, I appreciate Jen's perspective in acknowledging. I mean, I think we live in a time where we have accessibility to amazing resources, and when you talked about a citizen scientist, I think one of the things I have come to appreciate as a chiropractor. You know, a lot of my colleagues, I'm grateful that I have accessibility to, my phone is an amazing network. It has accessibility to amazing physicians, counselors, and behavioral health experts and community leaders. And so I feel really grateful because as a chiropractor, we get a lot of our referrals into our office, both in our chiro office as well as in Living Well, where the traditional intervention, whether it was a physical intervention, a behavioral health intervention, or a social spiritual resource, wasn't adequate. And so a lot of times people will send people into our office and say, well, just go there and they'll help you. And one of the things that we know for sure is that Living Well is a great resource because we have accessibility to amazing people. But the most powerful resource that we have that I believe at times we minimize is our own ability to participate in the process of healing. And so as we talk about pain and from a physical perspective, I think a lot of times I'm amazed at how many times physicians will send patients into our office and we talk about we're looking for the splinter. If it's an issue of pain, we're finding out, is it a physical issue? Is it a psychological issue? Is it a lie that people believe? Is it a disconnection internally that as Jen, you referred to the scientist, the citizen scientist, I think if we all could empower people to participate in the process, that we not only would realize that we have accessibility to amazing resources, but we would also recognize that we in and of ourselves are a resource. And that oftentimes we don't value our own understanding. John, I so appreciated, I mean, John Spannyberger, I love to watch and listen to you as you share your years of wisdom and how you've grown. And John writes, when you talked about how the body, the mind, and the spirit are interconnected, I would tell you that that's probably the most valuable resource that we get to provide at Living Well. Is that even as a doctor myself, and people come and for some of our patients, they won't go to their medical doctor unless they've talked to Dr. Dan or Dr. Penny. And we have people come in with broken fingers, or their little kids burn their hands, and they come into the office and say, I mean, the kids will cry, just Dr. Penny or Dr. Dan, just fix me. And so I feel grateful, but I have to tell you, in all honesty, sometimes the physicians would send us patients that clinically, I can't even begin to think I would know really what to do with them. But I would tell the patient and then the referring physician, as a chiropractor, when all you have is your head, your hands, and your heart, you have to get pretty creative. And many of my physician friends who have prescriptions or they're surgeons, I mean, you know, I think they have an appreciation for their expertise, and I'm grateful for their expertise. But if you're a medical doctor who has a prescription pad, and Jen, you would know this better than most, patients come into the office and they want a quick fix, like just make my pain go away. And I think, as John alluded to, sometimes our body, when there's pain, it's telling us something. And I can tell you that we have a team of providers who are not all of them are clinical experts, but what we've learned together is that if we are experiencing pain, it's likely that there's a reason, and we need to figure out what is that reason. And so, Jen, I would just kind of put a little additional spin on your citizen scientist. I would encourage anybody listening that don't ever underestimate the value of your own insight. And that when you begin to know your body and know what goes on in your head influences what goes on in your body, and how your emotional and spiritual well-being have huge influences. The reality of it is that we're all going to have pain at some point in time in our life. It's not likely that any of us are going to get out of this journey without experiencing pain. And at some point in time, there'll be a transition from life into death. And I think as I've had the privilege and the honor to walk with people through a process of exploration and discovering about what really is making them feel alive and what can really take your pain away. We do have accessibility to amazing resources, but like I said, I think one of the most valuable lessons that I've had to learn by serving people when maybe there wasn't a solution for their pain, then the question is how do you learn to live through that and allow that to be a blessing that teaches you things that you wouldn't have learned otherwise.
Thank you, Penny. Kathy, would you add anything to that, either both from your experience working as a nurse in community or working with Living Well?
Thanks, Steph. One of our viewers, I'll go with that first. Scott was saying that, we're talking about how your body what you really need to do is with your body, but as a user, your body lies to you when you're taking substances. So it's, for those that struggle with that, renewing your body is harder because you're using substances that really are cleared or are clouding your mind. I guess for me, when we talk about this, and yet I love the citizen scientist. That was it's a great visual and a great thought. Yeah, there's so much that we can do, and yet our connection of our mind and our body and our spirit just together and just working and helping us be healthy and whole really is probably the most important thing. I guess I go back to, Jen talked about there's not a lot of patients at the hospital, or our census is down at the hospital, and where are those people? And yet I wonder how many people are out walking, or are people healthier yet sicker during this period of time, and what are they doing? So it's a curious thing, not knowing where the ill patients are, because clearly people are having strokes and heart attacks elsewhere or something. And yet, are people healthier because they're not stressed with their work or their home, or what is the stress factor that goes to all of this? I don't know.
Thank you, Kathy. I appreciate that perspective. And I think it does, on the one hand, we can look at people that are likely, like you said, experiencing strokes and heart attacks. And yet at the other end of the spectrum, people who a month ago may have thought they had a major health issue that required going to the ER, going to their doctor, maybe going through a process of discovery like Penny was talking about, that they now have to do a self-evaluation before they step out of their house and say, what do I really need? And even like Scott, who's viewing online, said, if there's something that's clouding your perspective, I think John shared earlier about what he's experiencing even with his eyes. And I think about the physical perspective that we have when we look at something. Can we ask ourselves when we wake up in the morning to look at that through the lens of what's going on in our mind, in our body, and in our spirit, and then ask, are we well? And what are we doing to actively participate in the process? Because I would be honest, I've been amazed and inspired by the stories that I've heard of people discovering new ways to be well, and even discovering what they thought was a major issue before. When you remove some of the stress and some of the variables, they look and think, wow. I mean, John has said this on a couple of our calls, life looks different when you remove that level of stress. And again, recognizing the other end of the spectrum for many people, what we're going through right now as a community and individually adds stress.
Let me add another piece to this, because being someone who's in contact with folks here, but also in Spain and in 2 Middle Eastern countries, one of the pieces that's interesting to me is to go sort of even into a wider system because each of us is part of a much wider system, and often the system affects us as much as our own person affects us. And one of the things that has really struck me is the difference between how some Middle Eastern countries are handling the virus and how the West handles it. The West handles it more as individuals and focuses on individual rights. In the countries that I'm aware of, and the country that I lived in, there is much more concern for the community. And one of the things that I think is good to keep in our minds is how we see community affects how well we will be as an individual. And you can probably track people of how they view the community around them, of whether or not the community matters or not, to how well they're going through the virus. And I think it's something that has just really sort of been right in the front of my mind as I work literally with 2 different parts of the world, of the difference it makes when you see yourself. And one of the advantages of this, people are beginning to see themselves in community. But even with that, you can begin seeing, Jen mentioned, even how some people are responding to this much more as what my individual rights are, rather than what is good for the community. And I think that's a really important thing for mental health, is how do I see my community?
Thank you, John. I'd be curious for anybody to contribute their own perspective on what John was just saying. And I think John brings an invaluable perspective that spans from central Pennsylvania all the way across the world. And it is valuable to widen our perspective. And I think there's certainly a dichotomy between having to look inward and recognize we each have an individual responsibility when we're in our individual homes. But then when we look outward, what do we see?
John, I agree with your perspective on how our culture views and participates in community. But I'm seeing a curious dichotomy here. While we have traditionally not participated or involved ourselves in the broader community the way some of the cultures that you deal with are and do, and we have over the last 10, 15 years driven so much more community online. Now that we're reliant online and we can't get out there and have the physical contact and the exchange in physical society, people are really missing it. And I'm hopeful that one of the silver linings of this is that when we are able to re-engage in traditional community, there's a greater appreciation for it. And people begin to operate more face-to-face and perhaps less online. As you know, we've learned the limits of an online society.
Thank you, Mark. Does anyone else want to share a perspective on what community looks like to them?
I think of my own life, and community has always been a huge part of my life as a child, and I think the human-to-human connection is so important to health and wellness, and you know, when I'm in pain, I turn almost immediately to my spirit, and I allow my spirit to renew my body, whether that's going outdoors, taking a walk, or moving, or prayer, meditation. And I think of a lot of our clients now, and they're really struggling, and a lot of this struggle is emotional or in their minds. And I think over and over, I'm just telling them to be kind to themselves, and because this is an important time to connect to love, and to reach out in love, and to let people know you are not alone in this. And I mean, I think pain is the common denominator in all of our lives, just like the coronavirus right now is the common denominator in all of our lives. And we're all in this together. And I think the best thing we can all do is just be kind to ourselves and to each other.
Thank you, Karen. Kathy, any other comments from folks online? I guess before we wrap up here in a couple minutes, the final question I'd ask the group is, what change do we want to see in our community? And I know a few of the people that are joining us on Zoom have shared that, but I do think that as individuals and as a community, especially the older we get, the more reluctant we are to change. And I think situations like this really press us to the edge of something that has us choose if we want to change. And so I think, like Jennifer said, there's no doubt we're going to experience loss and pain in our community as a result of COVID-19, both directly related to the virus and indirectly. But I also would say on the other side of that coin, we have a tremendous opportunity to change and grow as a community. So as community leaders who've joined on this call, what would you share as the takeaway nugget for our community of what could be possible that we could change coming out of this experience?
When we're going through life in sort of a normal way, there seems like there's not as much thinking systemically. But in a situation where there is a crisis, it's interesting how all different levels of community begin working with each other and helping each other. I think what we see in the crisis times would be really nice to see in times that aren't crisis, but really enable us to see each other as part of a network that really is a healing community for our communities we're in. And that brings all different levels together rather than have pockets.
Thank you, John.
I would add to that beautiful statement that I hope we come out of this with more gratitude. So the little things don't seem so little anymore. There's a lot we take for granted in typical day-to-day life, pre-COVID, that now I think we can reflect and say, you know, that wasn't so bad. And boy, I kind of missed that, even at the time if it seemed annoying. We know that gratitude is linked to happiness. And so if we can use this time to think about what we're grateful for in some of the darkest of times, and then keep that with us as we move forward, I think we as a society could be a lot happier. And I think with that happiness, we're able to focus more outward into some of the connections that you spoke of, John.
Thank you, Jen. Well, unless anybody has another nugget to share, it's 8 o'clock here, so we're grateful for your time and your engagement. Just to let you know about a few other community resources that we have been putting out there as Living Well Institute. We've shifted gears to a virtual platform with the exception of the clients that we're taking care of who are in crisis. And so on Tuesdays, we have a program at noon called Live and Learn. We sort of call it our Wellness Anonymous. It's a community gathering that people facilitate an inspiring dialogue, and it walks through our Living Well lifestyle program. For anybody who's interested, it's an inspiring way to really approach health and wellness and to learn and to live with each other. On Tuesday evening, John and I and one other community member lead a recovery meeting at 7 p.m. So that's for anybody, and it's friends and family of addicted loved ones, as well as people who are struggling with addiction. That can be found on our website. And then on Wednesdays, Kylie Coble, who's on our care team and who's Penny's daughter, leads a 3D balance class, which is a mindful movement class, which is great for people with chronic pain, great for people who have a spinning mind and need to learn some mindfulness techniques and a way to calm down their mind and really work out some of the physical tension and stress that's in their bodies. And then on Thursday mornings at 7 a.m., we'll have another community dialogue. So I'd encourage anybody who's watching online, spread the word if this is a helpful resource for you to gain a different perspective on health and wellness, and also for the folks that have contributed. If you have other professionals that you know who could contribute to the dialogue, we would appreciate it. So again, thank you all, be well, and looking forward to continuing the dialogue.
Thanks for inviting me.
Thank you.
Thank you.
Thanks,
Thanks,
Jen.
bye.